So we're at the top of the hour. So I think let's just start. Last week we had on our special guest, Michael Davis. DSOs are obviously a big player in our sphere here. So I kind of wanted to look at both sides of the equation. Selling your private practice to a DSO, is it a dream? Is it a nightmare? Does it just depend?
So there are different types of DSOs, I think. Some of the terminology that Eric and Dr. Davis used last episode, Eric used the term emerging DSO. So there's an emerging DSO, there's mini DSOs, there's large DSOs. And I think there's differentiating factors between all of those. A lot of times what happens, because we're in New Mexico and our market is really small, a DSO, which is a dental support organization, it is a big like corporate dental organization that assists dentists with all of their administrative duties, all of their hiring, their firing, their ordering, their supplies, their management, their negotiations with insurances, credentialing, all of that kind of stuff. They do all of that stuff for the dentist doctor, who is currently doing that right now in their practice, and they would rather just be doing dentistry. When Eric and Dr. Davis were talking about emerging DSOs, Eric had mentioned that there was a few dentists that we know of that actually were acquired by emerging DSOs that ended up filing bankruptcy.
Yeah, I was really surprised to hear that. I mean, on the surface, it sounds great, not the bankruptcy part, obviously, but having an organization that steps in to handle the administration and take the burden off of my shoulders. But not everything is as it seems sometimes.
Yeah, I mean, like, in a bankruptcy, any monies owed to creditors are under a certain, sometimes they appoint someone to talk to the creditors, and a creditor may be the selling dentist. So you have that, and you also have, like, with all the management functions that they're supposed to be doing, probably isn't going to happen. So the selling dentist may have to step in and become the manager of all of those types of duties until they figure out what is going on and how to get a solution to what's happening. I think emerging DSOs is really big risk because you don't really know, like, they don't have the history or the backing readily available for you to make a good decision on whether or not to sell to them. Then you have mini DSOs that are smaller. They don't own a lot of practices. Maybe they have three or more. They may have three or four. There's not very many. Those guys are also kind of risky because, a lot of times they'll use their own money, to finance these deals and stuff like that. And the capacity that they have to manage multiple offices is sometimes not so great because, they think they can manage more than two or three or whatever. But as they start to purchase more and more, they may or may not have all of that figured out yet.
It may be stretched a little thin.
Yeah, stretch a little thin. Exactly, Rachel. Because that's happened with dental offices that have multiple locations. I mean, we've seen that in valuations that we've done. I think they want to do that and start this mini DSO type thing, but then they quickly realize that, if there's a lot more work into it, and they kind of back out of that and don't want to do that. Then there's the big ones like Heartland,
Mhm.
you
Aspen.
know, Aspen, yeah, those ones. And I think Dr. Davis talked about how they kind of incorporate the selling doc into their organization where they just offer a certain percentage. Well, he said they used to offer 80% and now it's a less of a percentage. Because I asked, how has it changed?
No, they offered less upfront, like less of your percentage cash payout upfront, and the rest you get over the period of time that you agree to work for them if you meet the criteria that they outline. It is the perfect scenario for some people, just not for
Can you
all.
talk about that? Can you paint a picture as to who would be best served by working with a DSO?
In my experience, I haven't actually seen one of our clients actually sell to a DSO. However, I did assist one with some calculations when he was being courted by a DSO, and he was very interested in selling to a DSO. He didn't want to market his practice to an individual buyer. He wanted to go the DSO route. He was a young guy. He's not interested in leaving the area for 10 years or more. He just didn't want to own his own practice anymore. He wanted to be an employee. He didn't want the headache of having to actually manage. He's perfectly fine with signing on for 5 years. You know, he has no problem saying, I'll meet ABCD requirements. I just don't want to manage my own office anymore. So for him, you know, from his point of view, that is the perfect situation for him.
Yeah, usually DSOs, they have requirements before they even look at a practice, and we have to help help the dentist meet those requirements to present to the DSO so that they will do their own calculations of value so that they know
Right.
what, you know, if they're interested or not.
Can you elaborate a little bit about what factors sort of influence DSO's valuations of a practice?
There's been a few that have entertained DSOs, and I know that, or on the other way around, others that have told, like, that maybe signed listing agreements with us have expressed interest. I'd also be willing to sell to a DSO. And Kelly will say, well, they are going to be looking for these things.
So really, like, for instance, we have one DSO that 12 to 19% EBITDA minimum. They look at profit margin. Dentist is a personality. This is what they say. Dentist personality is a big part, is if it's a good fit or not. And they want it to be 68 weeks to close. What they offer is a 75% upfront of agreed upon sales price, which is less than what they used to do, what Dr. Davis said. They do a 25% holdback over the term of the employment contract. They do an annual 5% interest, and then they'll pay the dentist 25% collection plus profit sharing plus stock option. So they offer these things. And I think what Dr. Davis is talking about is that profit sharing is really important to the DSO. They'll provide back office support, all the compliance, accounting, payroll, taxes, etc. They will give the doctor an autonomy over what packages they select to help them with managing their office. And if the dentist wants to keep any decision making for the practice, they'll talk to them about that. So they do due diligence before, and if it falls into place with their model, they will put in an offer with conditions. There's a lot of times when I do acquisitions with private dentists that they get paid 35% of production. So, I mean, they get paid pretty high when it comes to their production when they sell to an independent dentist. The maximum amount of pay from a DSO's beginning after the sale is 30%. And it can go up depending on the tiers and what they have assigned for production over the period of the years that the dentist is going to work for the DSO. Some dentists don't mind that, especially if they have huge practices that they're, producing over $2 million. And so they're okay with that. And they know that working, in that criteria is going to give them a good living. They don't have to worry about, managing the office. They'll have a great work-life balance. That this is how they feel, especially the bigger ones, the ones that are working 7 days a week. They feel that, they can just concentrate on the clinical work and the patient care. However, they may have conflicts with how the DSO wants to deliver patient care as well, because even Dr. Davis talked about upselling work that may or may not be needed. I'm not saying that DSOs compromise patient care. I'm not saying that at all, because I don't have personal knowledge of that.
Well, it's not far-fetched to understand that the mindset may shift slightly when you're not working and answering just to yourself anymore. You're answering to someone else,
Yeah.
and your income is dependent on meeting the requirements that you signed up for someone else. It may be a little bit more pressure to know that you have to meet production. You have to meet a production criteria.
Sure. The trade-off in the doc's mind might just be like, yeah, I got, sure,
I'm
I
going
can
to go on
I can hit a
vacation this
quota.
month, but I'm going on vacation, so who cares? I'm answering to myself. I've already planned for this, no problem. Whereas if I decide to take 2 weeks off, what is that going to do to, my required production goal?
The question in my mind is the doc going to be able to just say, hey, you know what? I got the production thing down. That's why I wanted to do this, because I just want to focus on patients in, patients out. I don't have time to deal with all the back office stuff. So, it could be a win if the doc is just a high performer anyways and wants to just crank out procedures and whatnot and just be like, yeah, I got the numbers thing down. I just want more or I don't want to spend as much time doing, this stuff in the back that's just taking up my time, and I just don't want to focus on that.
There's other benefits too, like for instance, if it is a fairly large DSO, there could be learning opportunities that the DSO offers the doctor, all of their doctors, that they wouldn't have had owning their own practice, or been able to have these opportunities. There's also collaboration with other dentists in the DSO to assist them, to help them with, dealing with the day-to-day things. A lot of times, like entrepreneurs that are, doing their own thing, and I think Eric and Cheryl can attest to this too, they feel like they're on an island
I was
sometimes.
gonna say,
Even though they have their team that works for them, their team still works for them. They, any difficulties that they're having, running a business, they really don't have a lot of people unless they have like already formed a like a tight niche of other business owners to assist them. In a DSO situation, you have these dentists that are all together that, can collaborate with each other. So that may be another appealing aspect of a DSO. Or you have multiple practices that you own, and not a single person can really purchase multiple practices. You want to sell all of them. It might be hard in this particular market to sell, your dental practices, because each practice is worth $1.5 million, and you have 3 of them, and not one person probably could buy that. So if you're in a situation where you have multiple practices and you want to get out of the, working as an owner of 3 practices that are all a lot of money, maybe a DSO is your only bet to come in and purchase those practices, because there might not be a single dentist that can purchase all those practices.
dealing with the back office stuff, all that administrative burden is pretty much going to be, off their shoulders. And they also might get access to technology that they didn't have before. Maybe
Right.
some more state of the art, cutting edge tools will be available to them if they're acquired by a DSO that's invested in those types of things.
Yeah, and their staff can be certainly trained on new cutting edge technology that saves them time, and they become more efficient.
And I know it is a common thing that a DSO will offer you more than you could likely get from an independent buyer.
Yeah,
Like
at
if
the end
if
of the yeah.
like over fair market value, they're not they're offering you more, but it's the fine print, right? They're offering you more, but they're not going to pay you 100% up front, as if you were selling to some independent person who has to come up with their own financing to buy you out, you know. So, but the perk of that is if you stay on and you work for them for the period of time that you agree, that in the end, hopefully you'll come out with even more.
We don't want to come out and just say DSOs are evil. They're all shady and you shouldn't work with them, because that's not necessarily true.
I think the overall message is that you just need to know exactly what you're signing up for. Understand the benefits, understand the drawbacks or risks or whatever, and just weigh that and make sure that that works for you.
and consult with professionals. You
Yeah.
know, I mean, if you're interested in selling to a DSO or an independent doctor, you know, consultant professionals on, you know, the strategy and who you're looking at, because just like what was said in the last episode, you know, there are different types of DSOs. And so
Mhm.
you want to make sure that, you know, who you are entertaining has the ability to take on your practice and really secure your the rest of your career. The money may sound great, you may get paid great, you may, all of those things are great, but but once you start butting heads about control over the dental practice and the culture and the you know, the way that you see patients and their scheduling and all of those things, if you can't let go of those things, you have to really ask yourself, is this something that I can really do as a person, as a dentist? If you can't do that, then maybe that's not a good
And I think
avenue
that's
to
the
go.
situation if you're selling to a DSO or if you're selling to any other independent doc who you intend to continue working for. To have a good working relationship with anyone, whether it's one other person or a whole other business, you still need to be, aligned.
The difference, though, between the DSO and the working for an independent doctor is that if you are looking to exit within the year, working for an independent doctor, you know, maybe you have differences of things that you do, but you're still on an exit strategy. Like you're on an exit, a very quick exit strategy, even though maybe it might be 6 months or whatever, it's still shorter than when you'll have to work for that DSO. The DSO is going to require at least 3 years. So you really have to be able to commit for that 3 years. And then usually when you sell to an independent doctor, you have 6 months transition period or whatever, and you have put in place certain clauses to exit sooner if you have to. So there's always that thing when you're selling to an independent doctor that you are going to be working for. There's always something in there that says, if I can't handle it, I can leave. I can get out. But for a DSO, I think it's a little bit more difficult to do that because then you're not getting the money that
Yeah,
you,
you have to answer to them all day long,
yes.
about everything or else.
I think that that could be a bit of a shock to a dentist who is going to experience a loss of autonomy, not have that quick ability to make decisions on the daily operations.
Let's
Bottom
put it
line.
like this way too. So I have a client that she's trying to switch, she's trying to drop Medicaid.
Okay.
And one of the reasons why that's a big issue now, where there's a lot of dentists trying to drop Medicaid, is because Medicaid's reimbursement rates don't pay for an hour worth of hygiene right now in the market that we're in. I have a situation right now where a hygienist is requiring at least $48 an hour. I don't think Medicaid reimburses that. I think they're like at a $35 reimbursement rate. So if you're accepting Medicaid in your practice, you are having your hygienist clean teeth and they're spending a whole hour with the patient, you're losing money. Do you think that a DSO is going to do that? No. The DSO is going to look at it and say, well, if I'm going to pay that hygienist $48 an hour and Medicaid is only reimbursing me $35, then the hygienist is only going to stay with the patient maybe 30 minutes. So they're going to reduce time with the patient. So patient care, when you think about patient care, that could possibly be a part of it. And Dr. Davis, one of the biggest things he said last week was patient care should be number one. And that should be that should be your primary focus. So you have to look at those things. Look at their treatment philosophy, also before just looking at the money.
You talked about this, Kelly. I can't remember if it was your husband or if it was somebody else you knew that they were going to the same dentist primarily out of convenience, but without fail, every time they go in, they'd be offered all these upsells and things that they don't need. And so I think that's sort of the divide between patient care that is calibrated, that has a measure of emotional intelligence versus just, hey, we've got these products and services that we're trying to push whether we need it or not. And that is really how we as the DSO are going to build our empire, is by, pushing these products and services that may or may not fit you. And I think that's where people like Mike Davis are going to talk an eyebrow and say, I can't do it.
Yeah.
He's got a great, I find him pretty funny. I'm looking forward to listening to him again at some point. And then as far as the transition period goes, we hope for one that's smooth with staff and patients. Trying to think of what the challenges and drawbacks might be working with a DSO.
Well, and there's a selling dentist that sells to an independent doctor, and usually what happens in those situations is the independent doctor comes in and purchases the practice, and then they learn everything from the seller of how they're running their practice, how they're scheduling patients, how they're treating patients, how they're doing their treatment plans, how they're running payroll, all of the stuff that the selling dentist is doing, they teach the buying dentist. When a DSO comes in, they teach the selling dentist and all their staff the way they do it. So it's a transfer of knowledge from the DSO to the selling dentist, whereas the selling dentist, when an independent person buys that practice, they transfer knowledge to that buyer. So the transition, I believe, is harder with a DSO because you have many more people learning how the DSO needs things to be done versus having the incoming doctor learn.
And the nice thing, again, like as you said, if it's just one doctor coming in and it's one person, learning from the selling doc what to do, when the selling doc eventually leaves, the whole staff is still there to help through that transition period. The whole staff already has, whether they're written or established or whatever, they have some process and procedure that they can continue to work through and show, the new doc, this is how we do it. This is how we do it. Versus everyone learning something new.
So I think that the transition period for a DSO, they may offer it as a short transition period because they will come in and they will train all the staff and they'll get all the staff, up and running to their processes and procedures. But I think that the staff is going to, there's probably going to be a little bit of, pushback from the staff. There may be some, people leave because of, that change, that much of an abrupt type of change sometimes affects people negatively and they will leave. I think from a seller's perspective, it's better for the staff to sell to an independent person just because they can continue to operate the way that they do. And it may be a little easier for them because they can still, they can teach the new doc, the things. But then from a DSO perspective, having a DSO come in, you just really have to be open to that. I mean, you really have to be someone that is really open to someone coming in and saying, okay, we're going to overhaul everything that you've been doing and change. There should be some kind of communication with the staff prior to signing that paper. Once you decide that you're going to sell to them, I think that you need to really have a down to earth conversation with your staff and, and be like, we're all in this together, because staff are going to freak out. I think they freak out when it's that big of a change.
Yeah. And if enough of your staff say, I don't want to do this, and they leave, you still answer for the lack of production.
Yeah.
But if I were a patient and like my dentist office that I know is independently owned and operated, If he sold to a DSO and that became one of the big name offices, personally, I'd be like, what the heck? I liked the fact that it was an independently owned and operated business. You know, I like to support small business. That's my personal preference. So I might be like, oh, I don't want to go to one of the big name places. That's why I came here in the first place. You know, so I'd be worried about that. The first time I brought my kids to this dentist over here, they loved the hygienist. They loved her so much. Her name was Shelby. It's the same as my dog's name. So then 6 months later, when it was time to go back, they were like, oh my gosh, I hope we get Shelby again, you know, and they were like talking about how what a great experience they had. And then she's not there anymore. So they're like, oh, like, you know, every time you go, if you have to meet and see someone new, it's like, oh, dang it, I like the last one.
But really the biggest thing for me is to hire people to help you through the process.
Oh, yeah,
It'll be the best
understand
money you spend.
exactly what you're signing.
Yeah.
Understand the fine print. They could offer you $80 million, but is it worth it if they give you $1 a day for 80 million days?
Yeah.
Right?
Yeah.
Understand what you're signing up for.
That's Rachel. Rachel loves
I don't know. If I still
that.
got 60% of $80 million up front, I'd probably take it.
Thank you so much for listening to today's episode. We hope you enjoyed, and if you did, please consider subscribing to our channel and clicking that little notification bell so you never miss an episode. You can also pick up a copy of Getting Down to Business, the book by Norton Hindley, by clicking the link in the description below. We want to be there with you on your dental practice journey so you can succeed every step of the way. Visit our website at www.hindleyburgmaiergroup.com to set up a consultation if you think it might be time to get your business valuation or due diligence report. If you're considering buying a practice, we are here for you. That's all for now. We'll see you next time.
Dang it, Rachel, you yawned and then I started yawning. And I didn't
Oh,
know.
I
I don't know
know.
how to
I'm
yawn
so
off
sorry.
camera. So if I turn my head this way, it looks terrible.
It's 2:30, and that means I need a cup of coffee.
Oh,
It's
geez.
2:30, and I'm like, oh my gosh, that's my yawning time.
Kelly and I were just talking about pre-workouts and different ways to wake up fast. And we're getting way off topic here just for a second, but I was recommending one that I've definitely popped it. I've definitely scooped some when we've been on our morning meetings, and it's amazing how it just perks me up. But if I take it now, well, I'd probably be okay now. But if I take it at like 5, forget about sleeping, I'll be up all
See,
night.
I could drink a cup of coffee and go straight to sleep.
Really?
It doesn't make me stay awake, and I don't even know that the caffeine wakes me up as much as I just need something like something hot to drink is like,
Stimulating or something?
yeah,
Yeah.
I don't
Okay.
know. Maybe
Yeah.
it's just like in my brain.